Hi, everybody. I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I do a lot with facial balancing and collagen stimulation as well. I did a few of those for this particular patient over here. You could take a look and see with his results. I'll show you a couple different sides. I'll show you his forehead, which looks amazing. I'll also show you his cheeks, which looks awesome too. So I'll show you all that, and you could be able to see just how we did this in a couple of steps for this particular patient. I'll actually show you another image as well, which is really cool. So this is his post-scar treatment with the Subcision, with CO2 laser, with TCA Cross, and then we also did some fat transfer for the patient as well. So it was pretty cool because you can see, just look at these steps over here. Look at how smooth that skin is at this point. And it's going to continue to get better and better. This is just a couple months out for this particular patient because of how much fat loss he had. You know, there's no question that there was a lot of fat destruction that occurred with his acne, with his scars, and we need to restore that. But in order to lay the groundwork for that, we had to break up all that scar tissue. And you can see we did that with Subcision. I also had to resurface the scars as well, and that we did with laser. So, significant improvement with revolumizing the patient, very, very thick scars. And then, of course, just making sure that we could do this very safely, even in this patient's skin type, which a lot of people would have said that there's just no way of doing this. There was there's these are scars you just have to live with. Hi, Mrs. Jones. Good seeing you on. Good seeing you on tonight, too. This is a patient that I'm showcasing over here that I did at the end of last year, and just showcasing where we're at with him. He's from further away, so we have these photos over here. You can see just a lot of people come from out of state, and I just wanted to showcase this one because he's just super happy, really, really beautiful. And the recovery process for him, it did take probably about really for about 7 to 10 days for most of it, but there was still redness there that could still be there really for another, let's just say total about 6 to 8 weeks total. So it's possible, depending on how thick those scars are, that we have to go a little bit stronger. And then we also ended up doing fat transfer for the patient, which worked out really, really well. So the fat transfer helped solve a lot of his fat destruction, his volume loss, and that's where you can see that fuller lifting effect over here. And we put basically with the fat, we use the micro. There's just basically what we call the micro fat, and we also did nano fat there, which are the stem cells. And so some give it a little bit of volume, some improve the scars over time. So over the course of the next 6 months to a year, it just gets better and better and better. So it's really cool. This is just part of the process that I do. And you can see just looking at this patient, he did have very, very deep, thick scars. And he's somebody who wanted to get as smooth as possible. Doctor, can you explain more about fat transfer? Yes, sure. So fat transfer, we harvest it really from the flanks. Typically, we go on the umbilical area, and then we just go on the sides and we take out some of that fat. Basically, we try our best just to harvest what we need, and then we purify the fat. So what that means is we clean it up because sometimes it's just junk, there's blood in there, and we clean it up. We get this microfat in there, and then we basically now separate that microfat also from something called nanofat, which are the stem cells. And so we re-inject both of those, and we get volumization and improved skin quality. Thank you so much, Mrs. Jones. Appreciate you. Thank you so, so much. Let's see here. Not Jay is saying, when would you recommend doing a phenol peel, or is that more of a last resort option? No, it's, I did 2 last week, did another one yesterday morning, and I did today, one of the patients, I did the phenol peel, I did his dermabrasion today. It's something I definitely could do if there's severe scars. This particular patient, he didn't have the downtime required for a phenol peel, but he did have a lot of fat destruction. So I knew that fat transfer would be an excellent option. Resurfacing, of course, was helpful, but fat transfer was going to be really, really important for him. So revolumization worked out really well. You can see, again, just that significant improvement over time. This is going to get even better. His skin quality is going to continue to get better. So I love it, and I was showcasing earlier, just look at his forehead. I'll show you that again. So you can see just where his forehead was. Look at that. That's where his forehead, look at that. It's so much smoother. And those actually, you may not be able to appreciate in this particular photo, but his forehead scars were so deep and so thick actually that they did cause wrinkles as well. So the forehead actually caused, essentially what ended up happening was it was just so stuck and so thick over there. And so as you animate, as you talk, sometimes patients use their forehead muscles, the frontalis muscles, to lift up their brows, and it causes contraction around the scars. And that's why you can see sometimes with people with scars that their wrinkles are very, very deep due to their scars. Then over time, you can get looser skin too. So this is a de-aging process too. We de-age the patient just with the process that we did over here, which was with subcision, laser, and volume replacement with, in this case, we did fat transfer. So it's awesome. Again, this is a really, really nice, realistic improvement over here. Thank you so much, PK Farnsworth. Good seeing you on. Eric Callahan is saying, I see TCA Cross being done on empty ice pick scars with scar tissue at the base of the scar. Is it possible to TCA on an active pore with the sebaceous gland at the bottom of the hole? It is something that you could consider, but it's really risky to do it with just pores. You may end up getting it so that it dilates, it gets wider. So it's tough to say. Usually you want it where it's a little bit thicker around the edges, not something that you would really be pushing unless it is thicker around the edges like that. So typically not something I would be necessarily saying that you should be doing for pores, but if it's truly like let's say a scar, then of course we could do TCA Cross, we could do lasers, we could do something else for it. But if it's really just a pore, usually you want to more likely control that oil production. Rakaz is asking, can scars fade over time? I'm a big fan. Rakaz, appreciate you. Yes, they could fade a bit over time, but really what happens, especially like say for this particular patient, what happens is that sometimes you end up actually seeing your scars more as you lose weight, you lose fat. You could actually end up seeing your scars get a little bit more obvious. And in this case, that's actually what ended up happening for this patient. And he's in his 40s, and he ended up basically noticing his scars get worse as he lost some volume. And what happens is that scarring, the acne by itself, had destroyed your skin. It destroyed some fat. And then if you don't have much fat to give, now as you get a little bit older, that remaining good, healthy fat that you had that was just not touched by scarring, that starts to deplete. And now you can really see a lot of indentation now due to the scars. So not a great option for, or I should say not a great thing for patients when there's fat loss on top of acne scarring, because even if you resurface and resurface and resurface all day long, you're never going to get it really fully smooth until you solve that fat destruction. And you'll see a lot of people over and over and over again with that kind of volume loss. And the people that really struggle with acne scars after they've done treatment typically are the ones who don't do volume replacement. They just choose not to do volume. And it just doesn't make sense. If you look at the pathology of it, if you really understand this, you'll see that fat cells themselves become actually scarred tissue. There's actually essentially there's scarring inside the fat. And that means that you really have to do something for that volume, because no matter what you do, it's still going to be indented. It's still going to have this atrophic area because of the fat destruction. And no matter what, even if you gained a lot of weight, it'll still be indented there. So you got to do something there, and we opted for fat transfer because of how much fat loss there was. But certainly we could do other options too for patients without any fat. Thank you so much, Kelsey. Thank you so much. Kelsey saying, I'd love to be seen by you. My acne scars are so bad. Go ahead and book a consultation at drqazi.com. We'll be happy to help you out with that. So go to drqazi.com, and we have our prices on there. You can just see, and our consultation does go towards the procedure if you end up going through the, if everything makes sense for you. You can do that though. Let's see here. Snack Scout is saying, hi, I'm a derm PMA, aspiring derm PA. What procedures did this patient undergo for the acne scarring? So we did a few steps here. We did TCA Cross for the boxcar scars. We did Subcision. We did laser resurfacing. And then we subsequently, about 4 weeks later, did fat transfer for this patient. So a few different steps here. And it worked really well. Thank you so much, Mrs. Jones. You're so kind. Oh, thank you so much, Sailor Moon. Sailor Moon saying you're the best, Dr. Qazi. Wow. And I appreciate I see a lot of my patients on here. I see some familiar names. One of my patients today, she came in, did some lip filler, which looked awesome, by the way. And she doesn't have any acne scars. She says she just tunes in every day, or just whenever she can, I should say, because she just wants to learn. And that's like interesting. Like I like it because like I'm a curious person too, and she's very supportive. There's a lot of patients on here right now who don't have scars, and they just come in and just like they're very supportive of this whole world. They just want everything to be better for people, however they're suffering. They just want to improve it. Let's see here. How many procedures would you do at the same time? So it depends. Like I wouldn't do fat transfer at the same time that I do subcision because it's not going to be in the right area, the right location of this, really the right depth of the skin. It's really tough to make sure that you could be really accurate with fat done. And so instead we do almost everything but about fat transfer. So pretty much everything else we could do that same day. Sometimes on the lower part of the face though, I won't do volume replacement that day too. But that means that we could do Subcision, we could do TCA Cross, we could do laser resurfacing, and if it's in like the upper part of the face, I could do some volume replacement too. Have you heard of a device called Red by Elevare Skin? I was given one and it's $10,000. Sounds like a deal. I mean, most of these devices are way more expensive than that. These lasers are in the hundreds of thousands of dollars. So sounds like if it's something useful for you, hopefully it is something useful for you. But $10,000. These prices, by the way, they just make it up. They make these prices up. I got a device one time, a long time ago. I got a device and it was no joke, it was $180,000. I didn't buy it for $180,000. It made it seem like I got such a great deal on it, and it was just like crazy. But I found out, no joke, because it's actually you could see where things are manufactured. You could take a look and see the whole thing. It turns out it was actually a device that was made in India. And it was actually, if you get it from the company from India, it was $4,000 from there, $4,000. And this company in America was charging $180,000. And they're like, oh, well, we did like our own software. Like, dude, for $4,000, like if you get $4,000, you could put you could get the best software developers around, and it's still not going to cost anywhere near $180,000. Like not even like in the same same section, like not even close to that. So yeah, that's what they do. They just made up prices like this for their lasers and energy devices. It's so wild. Jocelyn Gomez saying, would you be willing to do a consultation on live if someone was willing to do so? It's possible, but I'm not sure. There's a lot that's involved with that though, and I think it's really hard to set up for doing it on multiple platforms then. So I'm not entirely sure. So I can't promise it. I'll have to ask the team if that's possible or not though. To do it on like multiple platforms at the same time. Adrian saying, what do patients do for maintenance after they achieve their maximum results? Scars never fully go. So yeah, you could do really a few things. Really, the pigmentation cream works very, very well that we use. And then on top of it, I recommend tretinoin after a certain point too. That's going to end up helping. And then do low energy lasers. Just like a couple times a year, low energy lasers works very, very well. So consider that. It helps out a ton. So that's what I end up doing. And really, it's just, it's so good for your skin. Let's see. I know I missed a bunch of questions here. Not Jay saying the results are amazing. Appreciate you. Hi, doctor. Does microneedling cause fat or muscle loss? I would say that the radiofrequency microneedling can cause that. Radiofrequency microneedling, but regular pen microneedling, not going to help too much, but I just don't recommend it for scars though. So if you're doing it for scars, wouldn't recommend doing that. But radiofrequency microneedling, people recommend it for scars. Actually, I had a patient today and she went to a physician for rhinoplasty consult, and the guy's telling him to do Morpheus 8 before doing rhinoplasty, which, thought process is that it'll soften up the issue because the skin is really the tissue because the skin is really thick. But it's really pretty questionable because there's some doctors that end up just using like an ultrasound, like the piezo technique, and they can help reduce that thickness pretty nicely without much scar tissue that could be caused by something like Morpheus 8 in a small little localized area like that. So not sure about doing radiofrequency microneedling unless it's more for like skin tightening in certain areas. Definitely don't recommend it for scar purposes for the vast majority of patients. Let's see here. Low energy lasers like Halo. No, Halo is not actually low heat, low energy. There's actually a lot of heat with Halo. It's a lot. I don't know if you've ever done Halo before. There's a lot of heat with it actually. It's a nice laser. It's like, it's nice as a quick pick me up. It's good for if you have a few days of downtime. But if you are darker skin type, you could get post-inflammatory hyperpigmentation. And there's more risk with it involved with the Halo laser than there would be like something like an erbium laser, for example, especially at like just lower settings there. So just do it that way. Erbium settings look very, very well. Does radiofrequency microneedling really work to kill sweat glands? It could, yeah, it could kill sweat glands. I think that I think that anything currently has the approval to do it that way. It's off-label as far as I understand it, but it's certainly possible. You could kill sweat glands. You could do that in the axillary area and destroy sweat glands that way. Let's see here. I have KP, so keratosis pilaris. I started using CeraVe SA lotion. Seems worse. Should I stop it? Yeah, likely you should stop that and do something with urea instead. So rough and bumpy actually works really well. It's called rough and bumpy. So take a look at that one. That actually works out pretty well. Did you use TCA for this photo? Yes, I did use TCA. I did do TCA for this patient. And I usually do really for boxcar scars, for like ice pick scars, even rolling scars actually. For rolling scars I do too. I do TCA that way too. What treatment do you recommend for forehead scarring? So that's actually what we did here. So forehead scarring is one of my favorite ones to do actually. I ended up in this case doing Subcision and doing laser, doing TCA Cross, and then we did some volume replacement. Volume, because there's so much fat loss with these patients, especially in areas where there's not much volume to give. So in the temple area, in the forehead area, you could really, really quickly lose your fat. And so, yeah, absolutely. We could do, volume replacement there, and it works really, really well. What's my opinion on Subcision? It's great if it's necessary. If it's the right patient, it's a really, really great option there. It depends really, but some people are doing it on people that they shouldn't. Some people aren't really equipped to be able to do it. They're not somebody that you should trust doing Subcision. But if it's the right patient, the right potentially scar or the right area of the face, then it absolutely could work really well. Californication, I actually love that show. I don't know if that's probably where you ended up getting. That was a good show. Californication saying, I had 2 halos for my skin texture with 0 results. Unfortunately, I hear that a lot. I hear that a lot from people. I think that, there's a lot. It's funny is because they had, you can actually, there's a lot of these devices that they try to add these things called consumables on them. So that's one of the things that they did with devices like you mentioned. And just, it's kind of funny because they just have like this, there's something to roll, something that they say that you have to just keep on purchasing this over and over and over again. And each time you're supposed to purchase it. So it's one thing you spend $115,000 to $215,000 on your laser device. And then they want you to pay money per patient. Every time you use you do something on a patient, they want to make money off of that too. It's like their dream. I don't know if anybody used to play video games or anything like that, but it used to be that like you get a video game and they would just give you like the entire game. Like it was just like you put in like I was like a Nintendo 64 or not even like the NES, the original NES. It was like you literally just put that cartridge in. You have to blow it because there was like so much dust on there. You blow it and then you put it in and the whole game is on there, right? And then it's like, it's working. Everything's perfect. It's like, it's awesome. And now it's like, you try to play a game. First, you have to download. You have to like wait like 2 hours. I just never even play games because it's like, you have to sit there. I'm like, oh, this is exciting. This is a cool game to play. And then you're like, try to play it. And it's like 2 hours to download the game just to like play it. And then like, it turns out that like half the game is unplayable because like you have to pay for it or it just doesn't work or something else. And it gets released some other way. And it's like crazy because they're spending like 200, like 600 million, $1 billion on those games, and they still try to get more money off of you like afterwards. They're like, hey, we gotta do like a subscription plan, we gotta get this person to like purchase more and more of our like useless little like currency on here, and it works like, and people just are like suckered into this whole thing. So it's really, really interesting actually, because I used to like you just plug in a little cartridge in and I used to play it. Yes, we can stop talking about games if you tell me, intuitive bestie, what your favorite game was. Raquez is saying, is fat transfer the only way to deal with volume loss? No, there's multiple options. You could do Sculptra, you could do Bellafill, you could do hyaluronic acid filler, you could do fat transfer, you could do all those things actually. Anything you want to do. Let's see. Abby's saying, just join. How did this patient in the picture get rid of his scars? So we did CO2 laser, we did Subcision, we did TCA Cross, and then we did some fat transfer. So we did all those things. Okay, there you go. Intuitive Bestie says that their favorite game was Mario. Perfect. Anyways, where is your office located? It's in Newport Beach, California, just about 5 minutes away from the airport. Adrian saying, I had a full syringe of Bellafill 3 weeks ago. How long after should you wait to see if you need more? So, probably the cow collagen is starting to get absorbed right now. You're seeing that 20% of it's still going to be there. They'll see a little bit more growth there, but you could do it. You could still do a little bit more, about 4 weeks or so. Sometimes if there's any question, I could wait 3 to 6 months or so afterwards. Do you offer FaceTime consults? Yes, we do virtual consultations. We do that. So I'd be happy to help you with that. I do it all day long. Like this patient, what we do is just circle the scars, say exactly how we're going to treat the scars, what we're going to do for each individual area. And it's really, really useful because most of our patients come from out of state. Most of our patients are from out of state. So how do you start setting that up? You just go through our page, drqazi.com, and just schedule a virtual consultation. We'll be happy to help you out with it that way. Let's see here. Cookies and Cream is saying, which HA filler is good for volume that doesn't have the risk of migration? They all do. They all have the risk of migration, unfortunately. But certain ones, like the Juvederm line, we call it Juvederm Movederm, because a lot of times they will move over time. They'll shift, and they're more reactive. They have Vicross technology. They're really proud of their Vicross technology, but it could end up being that that ends up causing nodules. It could cause inflammation, and really a lot of people just find that what ends up happening is that it looked okay initially, but 6 months, a year later, it doesn't look great. And so that's why I typically don't recommend for patients. Alex Carter is saying, I heard TCA Cross is best for ice pick scars with walls. My ice pick scar on the forehead is so deep you cannot see the bottom. It's a dark hole. Could TCA Cross work, or would excision be better? It depends on the location of this. So Alex, you have to see when you're smiling, is it on the lines when you smile, like the tension lines? Or is it something that potentially is an area where there's a little bit more tension, where it's bunching up? Like right over here, it's a bad spot for an excision. Like right here, it's like going to be like really this horizontal line. And I had a patient actually that I've been working on since January and been doing TCA Cross every couple of weeks because I couldn't excise that scar. It was just right here, right in the spot. It was a tough spot there, but it actually shrunk so well. And then I just did a laser on her a week ago. It's going to be even better right now. So there's a way to do it just with TCA, but you're right. If it is something that's in a right spot and you could just excise it, just take it out, get rid of that. And it'll hopefully become more narrow, more superficial, but go to someone who does a lot with excisions. Just do that. Will fat transfer help pitted scarring in the apples of the cheek? You would say that it sounds more like ice pick scars, and it could help with that. There's a lot of volume loss there, but you typically need to do more with TCA Cross. You a lot of times especially if they're bunched together like that, you have to do subcision there, and then we could consider doing some sort of volume replacement. But it's a tough spot because in this area, the apple of our cheek, we never want to put too much volume in. We don't want to make this like really overdone, and so you got to be really slow, unfortunately, with volume replacement. And yes, we could do fat transfer, but it may not be the best option. Californication saying, I was just in your office last Friday. I really liked the office and our first consultation. Awesome. Thank you so much for coming in. And hopefully we'll see you really soon. Elaine's notebook is saying, how many sessions was this? This was after 2 sessions, Elaine. And Californication, what did we talk about? What kind of scars did you have? That's, I think, the biggest thing is we got to see what kind of scars you had. And because you said you did halo and it didn't work for you. Are chemical peels best for light scarring? I would still say lasers, honestly. You could do TCA Cross depending on your skin type. Or TCA Peel. That's okay too. But a lot of people put too much pressure when they're doing the TCA. I saw a guy who was just scraping it constantly, and it's like that's like how you could really run into a lot of problems. The peel goes way too deep, way too much pressure. You could end up causing more burns, pigmentation issues. So that's, I would say, a lot more concerning. So laser is sometimes a little bit easier because people just follow certain protocols, certain settings there for them. Can we see a final result like them totally gone? Well, when I see the patients, most of my patients come from out of state, so I showcase the full spectrum. Some of my patients that I've showed over the course of 2 years, 3 years, then you may see it like closer to where it's completely gone. And we're not quite there at all for this patient. This is early on still for him. But at some point when I see him, we'll showcase some more improvement for his skin and see exactly where where else we have to do. The thing is that there's not like, you have to just change your mindset. You really have to change your mindset though about this 100% thing or just like complete resolution. Look at how severe these scars were. Look at how deep these scars were. These were very, very severe scars. There's no way around it. It needed to actually really just take a while to do this. It's not something that's going to be overnight. It's a process where we're going to stimulate collagen. We're trying to really get it so that we'll just make sure that his general habits, so he has a lot more collagen production in the future, continues, his fats just remains, so he doesn't have rapid weight loss anymore, things like that. And if you do all that, you get to keep these results, you get to keep the skin texture, and you shouldn't really focus and fixate on this concept that every single scar has to be gone. It's not possible to live that way. You just can't do it that way. There's going to be some scarring that's still visible, especially when it's severe scarring like this. You're going to have to change your mindset and just think of it really in terms of where it was before, where it is now. It should hopefully be something you feel much more comfortable and confident in your skin as time goes by. But it's a very, very slow process. You're seeing your skin every single day. It's so slow that it doesn't actually become noticeable to yourself until you forget thinking about it. You have to actually literally turn off your mind and stop thinking about it, obsessing about it. And it's actually going to be healthier for you that way. You're going to be able to focus on other aspects of your life, start thinking and planning about how you could do something else that's going to be really cool and to build something else that's going to be really exciting and cool for yourself. And do that. And instead of focusing on your scars every day, and then 6 months, a year and a half later, you're going to look at your skin one day and look at it even under more harsh lighting, and it's going to look really cool. And then you'll just be like, okay, that looks awesome. And now you could again just decide and be relieved, and you can move on and take care of the rest of the remaining scars if you want to. But sometimes it's like you're just fine in life. You may see some scarring here and there. It's like whatever. It's like a certain lighting. The point of this is just for you to be comfortable and confident that when you're out in public, when you're in social events, you just no longer feel people are looking at your skin. That's what the whole point of this whole process is. Every aspect of it is. Is there a way we could do a free consult if I come in the office or virtual? No, I don't do free consultations, but your consultation does get applied towards your treatment. So, hopefully you could just book it just directly on our page. All of our prices are on there as well, so you could just do it that way. Do phenol peels have the best results for acne scarring in general, or does it determine on the type of scarring and severity? I would say that there's a lot of variables with that, but it definitely could be a very excellent option, especially if you have scarring that's thick like this patient's. And if it was along the jawline, then it most likely could have been a very, very useful procedure because you could get more skin contraction with it. There's certainly better resurfacing that you could get, more collagen production that you could get with it. And it's just something that really can't be taken lightly. It just really is. I was talking to somebody the other day who's an anesthesiologist who didn't know about the fact that phenols actually cause cardiac arrhythmias. Just had no understanding about that. Was unaware, and he's somebody who does this stuff all the time, and and is well versed in this. And it's really interesting because very, very few people are trained at reading EKGs, are trained at understanding labs, trained at like doing everything that you need to do to make sure that these are done very, very safely. And a lot of doctors, a lot of people that are walking around, they already make a lot of mistakes with like antibiotics. You'll see a lot of antibiotic misuse. I had a patient the other day. She told me, and anyone who's on here is a physician or a nurse or a PA knows that this is just totally not what you do. But the patient the other day, I was like, "Why are you on this doxycycline?" She said she was put on it because she has a UTI. And anybody who's in the medical world, anybody, like any like first year med student will know that you never do doxycycline for UTIs. Like anybody knows that. And like, even some of you guys maybe that like aren't even in the medical world will know that you don't do doxycycline for UTIs. And you see that over and over and over again, that kind of stuff, that like just the inappropriate antibiotics. And now like they can't do the antibiotics post-procedure. That's why they don't like to do harsher, stronger lasers, because they're just uncomfortable with antibiotic management, uncomfortable with managing burns or wounds, things of that nature. And then on top of it, you expect them to sometimes do safely with, providing the pre-op clearance for patients, also double checking while they're doing the procedure, making sure it's safe. Those things, there's a lot of things that could end up happening if patients are going to somebody who's not comfortable with the medical side of things. And a lot of people are not comfortable with the medical side of things. They don't understand medicine. Californication saying, James, I also have lots of gray hair since I was 17 years old. Now I'm 37, almost a full gray, and it's a stressful life. I'm also ashamed of my acne scars and struggling for almost my whole life. I hope I will get rid of them partially. James was saying that he was worried because he has so many gray hairs at only 25 years old. I feel for you guys, because there's a lot of tension out there, a lot of stress. A lot of people are talking about how much stress there is, and it's like, my generation, we didn't have to go through so many different things. You guys go through I don't know, James is saying he's only 25 years old and getting grays. And it's like, there's a lot. I thought we were living through like crazy times back when I was like 25 years old, because we had the financial collapse and everything like that. And it's just like, still wild for people. But like when it comes to the scar portion of things, just look at this and just realize that there's hope for this portion of things. So this hopefully could be something you no longer have to stress about. This is hopefully in this world that is otherwise stressful for you, and there's a lot of different reasons why you may be stressed out, that this part of it shouldn't be stressful for you anymore. Keep It Zen, good seeing you on. Thank you so much for your message, by the way. Keep It Zen did her Phenol last week, just took off her recovery mask today. I see her on right now. So thank you so much. And I appreciate you so much, by the way, for that really, really kind message you sent. So Keep It Zen. You really had severe scars at one point, and then she's saying right now the result is incredible, and it's awesome to hear that, and it's going to continue if you take a look at this as something that's going to be a slow process, because that collagen production of the phenol really is amazing. It really, really is amazing, and that's why it's done. What I didn't like with the way it was presented before was a lot of people were just showcasing the phenol result as if it was, this instantaneous type of thing. But there's a lot more that's involved with it. Keep It Zen knows that we first did Subcision, then we did the phenol peel, and now 3 months later, we're going to do some volume replacement. So step by step, we're going to just improve her scar tissue and the significant volume loss that she ended up having. And it's going to look amazing at some point, but it is like a slow journey, a slow process. I know she knows about this, but a lot of people should be aware of the fact that it really does take a while for that collagen production with any of these procedures. And phenol really is another one that really is the case. Hi, Dr. Qazi. Do anesthesiologists not get trained on phenol peel procedures? How do you pick an anesthesiologist for your practice? Thank you. That's the same. The thing is that everybody should be trained, because we all learn about it early on in med school and how to do it. But I like to quiz everybody. I like to double check to see what's going on and where they are with things. And so I just have to make sure that people understand their pharmacology, and especially the anesthesiologists should really know it in and out. So that's how I ended up choosing our people, so we could keep it really safe for patients. Let's see here. Keep It Zen is saying the result has been incredible. I love that you're talking about hope right now, because taking off the recovery mask has given me so much hope already. The beginning is already a good start, though. I do see change already, though. Looking forward to more. Thank you so much. Keep it zen. And, already had such great treatment after, or great results after just the subcision part, which is awesome. And my patient today that I ended up doing the dermabrasion on, yesterday I did a Phenol on him, and I did a month ago or so, I did Subcision on, and his scarring looks so much better after the Subcision, so much better. And so it's going to look really, at some point, really, it's going to be a very, very smooth process for him too. And he had very, very deep, thick scars. So I really wanted to get a really robust collagen response. But he has so much scar tissue along the jawline. Sailor Moon saying, I like the screen name, Keep It Zen. Same with me. I love it. That's my whole thing, actually. Yeah, I don't know if I did it with you because you were so even keeled, but sometimes I have patients go through like breathing exercises while we're doing these procedures, so we can make sure that we can reset. I go through like just these little meditative type of moves, so that we can just make sure that everything is just like back to Zen. It turns out that, a lot of people will think that they're going to have pain, but what it is just a lot of anxiety, a lot of like concern about what's going to happen. And sometimes it's because they went to a procedure, they did a procedure before, and the person that they did the procedure on didn't do proper numbing or didn't do something else that was right, and they felt that like this, or they were worried that that's what's going to happen to them. So it's kind of tough for some patients, because let's say they did like Subcision. One of the patients from Germany said that she did Subcision and the person didn't use any numbing. They just went in there with a needle and just kept on doing it. She did it like 3 times, and it was like a horrifying experience for her. It was deeply traumatic for her. And she was so worried when when I told her to do Subcision. I said, we have to do Subcision because it's so stuck. She said, I did it 3 times. And she came in and she's just like, it's like nothing anyone had ever done before. And she's saying that the scars look much better. Everything looks much better. And it's like nothing that was ever done before. And, I don't know what someone was thinking doing a needle Subcision with without any numbing in there. It's really terrible. Cookie John is saying, hi doc, if someone is in their early mid-20s and they develop adult acne from sleepless nights and notice a pitted scar in their cheek, can it get worse or multiply with age, even with regular use of adapalene? Well, if it's truly a pitted scar, then you probably just want to get that tackled early on, and it can involve like excision, TCA Cross, potentially those are all options there. I'm not sure exactly how deep the scar is or what exactly is happening there, but chances are something like adapalene is not going to help enough there. When he said that doing TCA Cross in an active pore is risky due to widening, is it possible to kill a sebaceous gland permanently? With TCA, unlikely. It'll be unlikely to destroy that sebaceous gland permanently. And I would say that would be really, really difficult for me to see how someone would do that, capable of doing that. Eric Callan is saying, my pore looks so dilated when it's producing oil, but some days my skin is dry and the pore looks good. I heard isotretinoin can possibly help or have oil glands stop producing oil after long-term use, but I also heard that oil comes back after you stop using isotretinoin. Sort of. It does help reduce the oil production, and that'll help with your pores. That's true. But it doesn't like just go right back to completely the same way it did before. You could also do low dose Accutane in the future. And yes, you should be on some sort of topical retinoid. So you could do low dose tretinoin or adapalene if you want to later on. So consider all those. Thank you guys so much. Keep it sensing. So glad I did Subcision before all this. And I'm glad you did too. I really am. Your skin's going to look awesome. I'm going to see you again in about 3 months, I think. I think it's going to be awesome when we take a look at your results, and I know that you let us share it too, which I appreciate. So we'll show everybody those results. I think there's a lot of hope out there, guys. I think that there's a lot of stuff that we need to just kind of fix. And I was talking to patients today. There's a patient that was just like talking about how depressed they were just with their scars again. And it's like, she was coming into me, she was doing the procedure today, and just about how it was like so difficult for her and was watching me for so long. And it was just like, she didn't even know that you could do these things. She was someone who just didn't even know. She said that she just saw that there was like a photo of someone with like her skin, and like her, she's Hispanic, and it was like her skin type with her like type of scars. And she's just like, wait, like she could do something, because she said, people said that you can't do stuff with this. People thought that you can't do much with these scars. And it was depressing, because it's like, man, that's a terrible feeling that like there's no hope. There's nothing you could do. It's tough for people to wrap their minds around, because they could do face transplants. They could do so many different things out there. And they're like, wait, you can't fix these scars? It's just like, it's hopeless. And then she just ran across my page and just saw that you could do something. And then like, here she is on the table, and like, it's going to get really well. It's going to be really, really good. And it's like, I want that. I like that responsibility. I like the fact that there's a lot of responsibility like this to make sure I could do this really well over and over again. I like it, actually. I actually enjoy it. I enjoy that kind of responsibility. I think it's really important to have that kind of responsibility. I made sure that I'm really, really, really good at what I do, so that I could like say that really comfortably and confident that I'm very, very pleased with the fact that I have that kind of responsibility in life, that I have people's faces in my hands and their self-confidence, everything, their mental health, and I'm going to get them on a whole different trajectory in life and make it so that this is a life-changing improvement for them. And we could do it over and over and over and over and over again in a way that I think really should make you pause and think and realize that this is hopeful. There's not like something where it's like, okay, this is just like the end and you have to suffer from this. And the feeling that you had, people say that they got bullied by this. People say that they just feel like there's microaggressions with it, and they just look at themselves and just can't recognize themselves. And it's like really difficult because you have that background noise in your mind, and you can't focus on the things that you need to focus on. And so it's like, it's really cool to allow people to focus again. I actually really want everybody to be able to focus. It's actually really, really interesting. Mrs. Jones is saying she was told that she had no hope for her scars, but I've given her hope. I appreciate you so, so much, Mrs. Jones. Thank you so much for that. And thank you so much, Eric, too. I'm glad I was able to help you out with those answers there. And let's see, how many sessions needed for 15 years of deep acne scars and lots of volume loss on the face all over? So it's tough to say. I mean, that's a lot of volume loss, deep acne scars. That could go anywhere from $8,000 to $15,000. It's tough for me to be able to estimate, but there's a lot of fat loss that could take a while to improve that fat loss. So it could take a while, and it will take a lot more work and a lot more effort, but we could do it. We could get through it. And we take every payment plan, every single option out there, we take it. So just to make it really, really easy for patients there.